Brian, creatine used to sound like a gym-only supplement. Now people talk about muscle, brain, aging, recovery, even mood. How much of that is real?
Creatine is one of the best supported supplements in sports nutrition, and the story is now bigger than the gym. Performance is the strongest core, while brain energy, aging, and recovery are genuinely interesting research areas. The core mechanism is energy recycling. Creatine helps maintain phosphocreatine stores, which help regenerate ATP during short bursts of intense work. That is why the strongest evidence is not vague wellness. It is repeated high-intensity exercise, strength, lean mass support with training, and training capacity.
People also argue about loading, daily dose, and timing. Is timing the main thing?
For most people, saturation matters more than minute-by-minute timing. Loading can fill stores faster, but consistent daily intake is the practical center.
The brain claim is what gets my attention. If ATP matters in muscle, could creatine also support the brain when energy demand is high?
That is the exciting part. The brain uses energy constantly, and creatine may help most when demand is high or baseline stores are lower, such as sleep loss, aging, vegetarian or low-meat diets, and some clinical contexts. For aging, the most grounded positive angle is muscle, strength, resistance training, and preserving function over time.
Some videos say creatine helps recovery, injury prevention, and even concussion. Which parts are promising enough to mention?
Recovery is another positive use case. Creatine can support training quality, repeated work capacity, and lean mass gains with resistance training, and those benefits can matter for athletes and aging adults. One common surprise is water weight. Creatine can increase water inside muscle, which can be useful for performance but confusing if someone is watching the scale.
The biggest fear online is kidneys. Does creatine damage kidneys?
For healthy adults using standard doses, the sports nutrition literature is generally reassuring. The practical nuance is that kidney disease changes the discussion, and creatinine blood tests can need interpretation.
And what about hair loss? That claim scares a lot of people away.
The hair loss fear is much weaker than social media makes it sound. It mostly comes from a small hormone marker discussion, not strong evidence that creatine causes hair loss in real-world users. The people most likely to care are strength trainees, power athletes, older adults doing resistance training, vegetarians or low-meat eaters, and some people in supervised clinical contexts. People who are pregnant, have kidney disease, take complex medications, or are managing a medical condition should ask first so the supplement stays matched to the person. The creatine ladder is this: define the goal, use monohydrate unless there is a reason not to, dose consistently, train intelligently, and track whether the outcome matters.
So the headline is positive and practical. Creatine is a strong first-tier supplement for performance, with promising second-tier uses when the person and goal fit.
Exactly. Creatine is unusually well supported for performance, increasingly interesting beyond the gym, and best handled with clear goals, consistent intake, and sensible safety context.